We always get Coach Stowers and Coach Fall's crap. I told, she said, Miss Fall, like, I've been spending from like 1962. I said, yeah, she was probably 68.
I'm just giving you a hard time. There's nothing
Then
wrong.
I told her about Coach Stowers, Coach Fall, or Coach Stowers and Jesus played together. And Coach Fall
There's
still
nothing
at
wrong
Jesus
with
played.
Okay, let's get moving. We're gonna go through this really quickly, just because I just want us to talk about it, and I want you guys to be familiar with some of the ideas behind pain management and some things that you can do to help. So, we think about what is pain.
It hurts.
Okay,
So
Discomfort.
electrical something
Discomfort.
through your nerves.
does it have to be through your nerves?
What?
Does it have
I
to
don't
be
know.
through your nerves?
Yeah, I guess so.
Does it
You
have
can
to
have
be
nerves
physical?
everywhere.
You have to have-
No, you can have emotional pain.
I'm in pain.
Emotional pain.
That's an
So we say that pain is subjective. We've talked about that word a lot. What does that mean?
It's different to everybody.
Do I?
It's an opinion.
Mhm.
It's a,
Yeah,
It's different
Right,
to
it's-
everybody.
it's different for everybody. It's not something that can be measured. Remember, whenever we do assessments, like we talked about vital signs, when we talked about pain being the fifth vital sign, okay, your typical vital signs, your blood pressure and pulse, those are objective. They're measurable. If I take someone's blood pressure and you take someone's blood pressure, they should be about the same, right? It's measurable. But pain, now if we ask the same person, they may tell us the same answer, but they may not. And it's different for person to person. If I take your blood pressure, I'm going to take it the exact same way I'm going to take yours. And it's going to measure, not that y'all will have the same, but it measures the same way. Well, it's different with pain, because what one person says, you know, their pain is the most horrible pain they've ever felt. The next person may say, it's no big deal, you know. Okay, one of the most common reasons people seek health care, usually pain is a sign that what? Something's wrong, right? So that's one of the main reasons why people will go, because that tells you that something's abnormal. Most widely undertreated problem. So it's really easy for us as healthcare workers to focus on the main issue, but forget about the pain because it's a symptom. Does that make sense? So even people who, you know, can't voice, you know, like you think about some of the people at up at Birchwood, like they may not be able to voice that they're having pain, but does that mean that they don't? No. So it's something that you always have to be thinking about, even if they don't voice it. Just because someone doesn't voice it doesn't mean it's not there. And I think about a lot of times my home health patients, like I would ask them, you know, on a scale of 0 to 10, 10 being the worst pain you've ever imagined, 0 being no pain at all, where would you say your pain is today? And they'll say, oh, you know, it's like a 2. Let's say they're talking about some specific injury. Well, what about, you know, your arthritis pain? Oh, well, if you're talking about my arthritis pain, it's like a 7. Because that's a pain that they live with all the time, every day. And so they don't really consider that when they're talking about their pain, even though it's still something that needs to be treated. Does that make sense? So, the definition: unpleasant sensory and emotional experience associated with actual or potential tissue damage. So actual or potential tissue damage. So sometimes they may not, you know, again, it's whatever they say it is. Just because you can't see it or see whatever's going on doesn't mean that they don't have it, or described in terms of such damage. So again, subjective, interferes with the quality of life. What does that mean?
Interferes with the quality of life.
What does that mean? When you hear that word quality of life, what are we talking about? Okay, how you live. What else?
Things you can do.
Okay,
Regular routine.
we think, and we hear the term quality of life a lot when we talk about things like euthanasia. You know, we talked about the other day. Because when people's quality of life is reduced, that's when they start talking about those things. You think quality of life and yeah, what you're able to do and how, you know, just how you're able to live and so forth. This must be assessed on a continuing basis. It's not something that you go check on them once that day and they don't have pain. It doesn't mean that they're not going to have pain 2 hours from now. It's something you constantly are asking. Can compromise the immune system. What does that mean?
Message. Either destroy it or.
Get sick.
Well, think, what does pain do mentally for you?
Wears you out.
Yeah, it stresses you out is the answer what I had in my head. And stress also weakens your immune system because your body's working, you're worked up about stress and your body's not functioning like it needs to be. And the other thing that it does, and this is not really immune system technically related, but I always have, whenever I was doing home health, we saw a lot of like knee replacements, things like that. We have them on for a short period of time so they can get therapy in their home. And whenever, a lot of people were like, oh, I don't want to get hooked on the pain medicine, so they wouldn't take their pain medicine. But the problem is when the physical therapist would come, they would be in such pain that they couldn't actually do the therapy for the benefit of the therapy because they didn't want to take the pain medicine because to them, they didn't want to get hooked on it or they just wanted to go without it. But really it ended up taking a longer time to get well because, you think about movement, all that recovery is going to be painful. And if they're taking pain medicine, they're going to have more range of motion to recover faster. But if they're not taking their pain medicine, they're not able to stand that extra range of motion, it's going to take longer. So, something to think about. May hasten death by increasing psychological stress. So, same kind of idea. Okay, pathophysiology, so just in terms of pain, it says a sensation caused by some type of noxious stimulation. So some kind of stimulation that is kind of negative stimulation, unpleasant, like I said earlier. Pattern of responses that functions to protect the individual from harm. So how does pain protect us?
Tells you not to step hard on that leg or whatever.
Tells you when something's wrong.
Definitely. We read an article, was that last year in class, about that little girl who was born and she couldn't feel pain.
One of my friends, one female
Yeah, you told me that before. We read an article last year. I thought it was in principles last year, but maybe it was in health science. Or my health science 2 class.
That's scary.
Yeah, they didn't realize it. Of course, she's a toddler, and then she had like broken bones, but she didn't know because she didn't feel the pain. And she broke them because there was no warning that something was hurting. You know what I'm saying? It's kind of
Cool.
but yeah, pain is also
It was cool, but then again,
pain
it
is a
wouldn't
good
be.
thing because
So like you wouldn't ever know.
right, you don't know when something's wrong. So, well, I think about that guy I told y'all before who had that diabetic ulcer on his foot. Because he had such horrible neuropathy, he couldn't really, his nerves in his foot weren't working, so he didn't know he had that wound until it like soaked his shoe. And same idea, you don't realize that you've got something going on until it's really bad.
So I just like,
Everybody.
And you would have to.
yeah.
I mean, you have to do like an assessment every single day. Not know if you cut yourself and you're
You could
bleeding.
have your hand on something hot and you look and it's charred up.
Right.
That'd be crazy.
I need to look at that.
I think that's bone showing.
That'd be a hard thing to deal with as a parent too, because you think of danger.
No, just tell him to go on his brand shoes.
Oh. Does he need a gun? Whatever. So pathophysiology is talking about pain. Whatever the experiencing person says it is, and whatever they say it hurts. So pain is whatever the person says it is. It doesn't matter if you can see it. It doesn't matter if they're laughing or if they're crying or if, you can tell that there's some kind of horrible disfigurement. If not, it's whatever they say it is. That's what you have to write down at least. Now, here's how I chart it. If I go in and I ask somebody if they're in pain, and they're like, oh, yeah, I have a 10 out of 10. Okay, so the most horrible pain they can ever imagine. But they're laughing and cutting up and, moving easily. Then I'm going to chart patient reports pain 10 out of 10. Patient laughing, moving freely, banging their head against the wall, whatever it is.
What would
So-
you say is like a 10?
Straight up like broken.
wound or like a getting shot or
Yeah.
I mean,
Bird.
it's
or
different
something
for
like that.
everybody. I don't
That's
know.
what I
I mean,
would
I've
say.
had
Bird.
patients
That's
who
what I
I
would
ask them and they're like, "Oh, my pain's an 11," you know. So, I mean, labor. I would
shots.
say labor was.
Labor for you.
Mhm.
What if I shot you right now?
I don't know.
Yeah.
They say that.
Tell me.
I read something the other day. They say that labor pains are like. What did that mean? I don't remember where it was. But they say there's like certain. I don't remember how they like measures of,
You get like a
feeling
thug
or
that's
something,
been through so
and that
much.
labor is like far beyond what. I don't
But that's different for some people, right?
It
Because
is.
her mom had 12 kids, right? So,
I'm done.
she
Yeah,
had
the
12
pain must not be that bad.
know. Yeah, definitely depends on the person. But I would put it up. They say that kidney stone pain is some of the most horrible.
Yeah.
Oh, yeah, I heard that
Bone
before,
pain
that
is
too.
another one you hear a lot about. Like people have bone cancer or osteomyelitis or something like that. They say bone pain is really excruciating too. But I don't know. I mean, like I said, it's different for different people. So, assessment of pain. So, some things that we're going to look at. I really wish I had my little cards, and I'm so aggravated. Maybe I just didn't take them up when I passed them out last year. Maybe I could make them. I don't know what I did. Okay, so some things that you want to ask when you're talking about pain. So aggravating or alleviating factors. So what makes it better? What makes it worse? Okay. What medications have they taken? Did it help? Did it not help? If it didn't help, then they need something different. Okay. The meaning of pain. So reactions to pain vary depending on cultural backgrounds. You know, some cultures are very stoic. They're not ever going to show you facial expressions, and then some are more animated.
That's true.
Physical exam, so adds to the information. Obviously, you know, if they're like pinky finger is sticking out this way, that probably hurts.
Like
So that can clue you in
evolution.
that something's going on.
Okay.
And then reassessment. So constantly reassessing to see if any changes need to be made. Okay, so again, physical exam to just check them out and see what's going on with them. Psychological and cultural assessment, again, it's important to take those into account whenever you're doing an assessment and then figuring out the cause of it. So we talked about physical pain a little bit. Emotional pain can be lots of things. You know, depression is something that you hear a lot about. Emotional pain, just all kinds of anything. Behavioral sense pattern of responses that functions to protect the individual from further harm. So again, like we said earlier, it helps you to prevent from something else happening. Okay, so different causes. Cutaneous, we know means skin. So that's like a direct stimulation to the skin. So you get cut or burn, those kind of ideas, that kind of thing. Somatic, usually from, says the musculoskeletal system. So sprain, could be a break, that's all somatic pain. And then visceral is your internal organs. Stomach, if your stomach hurts, kidneys, whatever else might be hurting. And y'all heard some of those terms before too. Neuropathic would be
Nervous system.
nerve pain.
So, like, when you mean nervous pain, do you mean like just your spinal cord, or like all your nerves all over your body?
No, it can be nerves all over your body, like
Like
neuropathy.
pinched nerve.
Or like a pinched nerve, or a frayed, like something that's like a burn, for example, that has caused damage to a nerve. Diabetes causes nerve damage. I had a patient who had such horrible neuropathy that the sheets laying on her feet were like excruciating to her because of that, like the tingling nerve pain that she had. So she could not handle anything on her feet, even just like one sheet.
Oh, is that what you said? Like made a box thing?
They can, yeah. But now the people that had the box actually, and you see those pretty regular, was because her skin was so bad she would get ulcers on her
that's right.
toes, like pressure ulcers from the sheets laying on. Referred pain. This is pain that arises from somewhere else. Like, you know how kids do. Like, they hit their knee and they're like, oh, my stomach hurts. Okay, that's kind of an example of referred pain. Another one would be like somebody having a heart attack, but maybe they have pain in their arm or their jaw.
When I got my tonsils out, my ears hurt. Like, that's all that hurt was my ears. And he said that that's her.
I hate ear pain. Ear pain.
It was awful.
Yeah,
Earaches, they're awful. That'd be a 10 for me.
Okay,
I
so,
was always like,
description of pain. So chronic, y'all know what chronic means. Occurs over a long period of time versus acute, which is something that happens all of a sudden. And like appendicitis is usually an acute illness versus diverticulitis, which is something that you have for a long period of time. All right, so assessment-wise, questions to ask. You can go, there's actually a couple different mnemonics that you can use. PQRST is one of them. So provoking factors, so what makes it worse? Q is for quality. What does that mean?
Like how bad?
A lot. Okay, a lot.
And then
How difficult.
Right, well, usually when you hear the word quality, that's like you want them to give words to describe it. So what does it feel like? What's the quality of the pain? Region or radiation, so where is it? What does it radiate? Like we said, does it go down your arm? Does it move into your, sometimes back pain can go down one leg or the other depending on the nerve involvement. Severity, so how bad is it on a scale of 0 to 10? And then what are other symptoms? Are they throwing up? Does it make them have a headache? Does it make them see things? Whatever. And then timing. When did it start? How long does it last? Some terms on quality. Sharp pain. What are some other things that people say? It can be sharp. It can be dull. It can be numb. Tingling, burning. And that's a good way to say, you don't ask somebody, what's the quality of your pain? They're not going to know what you're talking about. Give me some words to describe it. What does it feel like? Is it an ache? Is it sharp? Does it feel like,
Doesn't stab.
yeah. Having point to the area that hurts, it's always a good way instead of having them describe it. Okay, so it says nurses discover they can get responses from children by using the FACES scale, and we've looked at this before. This is it actually here at the top. Yep, Long-Baker FACES scale. So typically you see this one in 0 to 5, and I actually think at this point they've changed it to still be 0 to 10, so that it's all the same. But this is what it is. You'll see this. So 0 to 5. Now, the only time you use a FACES scale, so yeah, I don't have that. The only time you use a FACES scale is if it's a child who can actually point to how they feel. And you don't like hold it up to them and be like, you're making a frowny face. I think you're a 3. It doesn't work that way, okay? Because we know.
For those off, it's closed.
Anyways, but they have to be old enough that they can point to how they feel. So you use it to have the child, okay, this face means this means you're not hurting at all. This means you're hurting a little bit more. Means you're hurting a lot, a whole lot, and the worst ever. Okay, can you point to which face that tells how you feel right now? Okay, so that's how, it's not, again, they have to be able to point to it and tell you that in order to use that appropriately. Okay, now for adults, okay, I would say teenage up to adults, you use what's called the verbal analog scale. So 0 to 10. 0 is no pain, 10 is the worst pain you can ever imagine. what do you feel like best, what number do you feel like best represents your pain right now? It's always right now. It's not, what was it before? What is it right now? You know, maybe it's a 2 because they just took pain medicine. So then that's what you chart. You know, patient states pain is 2 out of 10 currently, took pain medicine 45 minutes ago. You just, you know, you can only write down, here's the, I'll say visual, but it's actually verbal. But you could use your visual one too. Researchers say that patients cannot function with a scale more than 10 points. So I guess it just gets too complicated. I don't know. Here's the long, bigger faces. Yeah, this one's numbered up to 10. So, but yeah, they have to be able to point to how they feel. Now there's other ones. Here's a flat scale. So this one actually you use if they're nonverbal. Typically, you can use this on babies or kids that can't point to the faces scale yet. And you could, they have kind of an alternative version for people who are older that can't verbalize how they feel. But these are the things that they look for. And this is a mnemonic. So face, and you just, after you pick out what they have, then you just know, you add it up. And it'll be out of 10 again. So their face, 0 for no expression, or if they're smiling, 1 for an occasional grimace or frown, or if their eyes, you know, kind of look anxious. And 2 is a, you know, constant frown, clenched jaw, quivering chin, deep furrows on their forehead or their eyes closed. Legs, normal position, they're uneasy or restless, and then 2 is if they're drawn up or if they're just really kicking. Activity, so if they're lying quietly, no big deal, 0. Squirming, shifting back and forth, 1, and then your arched, rigid, or jerking, give them a 2. Cry gets worse, and consolability is at the bottom of this. So 1 is they're calm, content, you don't have to console them at all. 1 is that, you know, you might can pick them up and they're okay, or you give them a pacifier and you can console them, that kind of thing. And then 2, you only give them that if they're really difficult to console. You pick them up and try to hold them, but they won't quit crying. And then you circle those and add it up, and that gives you a number out of 10. So that's another pain skill if they can't talk or can't point. So just because a patient cannot respond to pain doesn't mean there is no pain. Okay, just like the people at the nursing home, okay, that you saw, just because they can't verbalize it, or just because they don't have the mental capacity to tell you or understand it, doesn't mean that they don't have it. Their activities of daily living may be affected. What should be affected, shouldn't it? Not affected. Let me fix that. What are ADLs? What are some examples?
Walking.
More like eating, bathing, activities of daily, things that we have to do daily to function. Take a bath, eat. Could be sleep, but it's more like things you actually do. Brush your teeth, you know, feed yourself. Those are activities of daily living. And we know those things can be affected. Hey, if you're hurting so bad you can't get to the bathtub to take a bath, then that's pain is affected. Neurostatus will alter the response. So if they have something going on neurologically, that can change their response to pain, make them feel more or less. Management needs to be timely. So it's not, you know, you don't want, here's one thing, and I always tell my grandmother this, and she doesn't always follow my orders, but anyways. One thing about pain is if you wait until, let's say, you know, I don't want to take my pain medicine. So you wait until your pain is like an 8 out of 10 to take your pain medicine. Okay, well at that point, it's only going to come down to like a 5 or a 6. But if you can tell that your pain's kind of starting, and it's starting up again, and it gets to like a 6, and you take your pain medicine, then what's it going to do? Yeah, it's going to bring it down to like a 2 or a 3. So if you stay on top of it, especially when you're having acute pain, like post-operatively or you had a recent injury, you stay on top of that medicine and take it when you're supposed to and not wait until the pain gets really bad. It manages pain much, much better. Does that make sense? You know, a lot of people, and I'm not saying people do get hooked on pain medicine. Absolutely. I mean, you don't know that. But there's times when you need it, and when you need it, you need it. You know. People get scared of it, but needs to be individualized. Again, everybody's pain is different. There's actually, especially the bigger hospitals, and Paris probably has someone too. There's usually like pain specialists. There's nurses that just work on how to better pain management. We'll go see specific patients who are having pain issues and things like that. Management has to bring pain to an acceptable level of tolerance. Okay, an 8 out of 10 is not acceptable. Okay, that's not working. Even if their pain was a 10, an 8 out of 10, it may be better, but that's still not acceptable. You know, they need to have adequate pain control. Pharmacologic interventions. So again, needs to be individualized. We have 3 categories. Non-opioids. This is like your everyday medicine. Okay, opioids are the opiates. That's like your morphine, Dilaudid, all of those heavy duty ones. Non-opioids. This is like your Tylenol, Motrin. Those are all non-opioids. Opioids, again, that's kind of like your post-operative pain medicine, morphine, Dilaudid, and then adjuvants. Tylenol, aspirin, NSAIDs. Anybody know what NSAID stands for? Non-steroidal anti-inflammatory drugs. Non-steroidal so ibuprofen, Aleve, those are all NSAIDs. Opioids, weaker ones are your codeine and oxycodone, Vicodin. Strong ones, hydromorphone, I should have seen it, morphine or pyridine. Adjuvant says primary function is not pain relief to provide other relief. Like this would be like anti-anxiety medicine or maybe anti-nausea medicine. Other things that would come alongside of it. Precautions of giving them pain meds. You don't want to give 2 from the same class. Okay, so if you guys ever take your medicine, you don't want to take ibuprofen and Aleve. Those come from the same class. That's going to be really hard on the kidney. You wouldn't want to take morphine and Dilaudid. Okay, you wouldn't want to take hydrocodone and oxycodone. Allergic reactions is a big one, and then just effects of the medication. So different ways to give the medicine. We have oral, pills, injection, again, giving a shot, IV. You know what a PCA is? I can't even think of what it stands for right now. Oh my gosh. But a PCA, that's like the button. Y'all ever, anybody had surgery and then they give you a button to push that delivers a little bit of pain medicine? Now here's what, one thing about those is some people get scared that they're going to give themselves too much, but it will only allow you to give, like let's say they have it set to go off every 10 minutes. Okay, so that means every 10 minutes you can have 1 dose of medicine. It doesn't matter if you push that button once or push it a bazillion times the whole time. It's only going to give you that maximum amount of dose within the time period. Usually these are only given for a short time, like while there's still really acute pain right after the injury or the surgery. And then they'll go to regular meds after that. Epidural is intrathecally is the word, but it goes in through the spinal cavity. Rectally, topically. Oops. Mild pain, you give your non-opioids. Moderate pain, usually oral medicine. And then severe pain is like your IV medicines.
Time ago.
Yeah, let's see. There are some other things that people can do. You know, imagery is one. Stress relieving is another thing that can help people with pain. Relaxation, dimming the lights, you know, things that help people that typically help people calm can also help them to remove stress. And then a TENS unit, y'all are familiar with that, right?
Sure. No, that's wrong.
TENS, trans-electrical muscle stimulation. That's what all.
Oh,
these
yeah,
are.
yeah, yeah.
Anyway, interesting. Okay. Well, y'all don't forget Tuesday, 7:30. Make sure you wear your shirt, tuck it in. You know, wear jeans. Bring money to eat lunch. When you come with money, let me know.
Made about $1,000.
Not that.
Got a drug problem.